Hi, class. So we are going to get into chapter 3 today. Let me just switch over here to the slideshow. We're going to be talking about health histories, assessments, evaluations, different types of health screenings, as well as evaluations and referrals. All right, so we're on chapter 3. And really what I want you to be thinking about when we first start talking is what would you want to know about a child that's brand new to your preschool class? We're going to kind of have that be our example, or what kind of set the stage for us. So one of the first kinds of information you receive about a young child, especially if they're new to your daycare, your preschool, as in this example we're going to be using, even elementary schools, are health records and histories. So getting to know a little bit about the past that the child has had. Depending on the age you get them, sometimes they don't have much of a past because they're little, or depending on how many health issues they've had or how much care they've needed. It may not be an extensive story, but it's important to know that information. And so we're going to get into it, and we're going to pretend that we are meeting little Kara for the first time. She's 4 years old and she's going to be joining our preschool soon. And so we're wanting to get a little backstory, a little bit of information from her parents about her. And so some of the first, most basic information is going to be, let me just move myself off of this. There we go. Is the medical and physical health history. So you want to know if this child has any kind of special conditions, whether those be chronic conditions, especially anything that they take regular medication for. So things like allergies or asthma. Those tend to be the most common, but there's also others. You also want to know were there previous injuries, hospitalizations, like especially these days, so many premature babies are surviving because we have the medical technology that can make that happen and make that possible. But long, extensive hospitalizations set children up for developmental delays, or set them up to have other types of conditions that we need to be aware of. Sometimes they're not obvious. You can have a 4-year-old that looks very much like a 4-year-old and find out that she was born 2 months too early. Children have an amazing way of adapting and catching up, but there still can be some brain development that is different. And so you want to know those things. You want to be able to be prepared for that. Along with prematurity should come an extensive medical history with lots of different evaluations. So there should be quite a bit of information about this child if in fact she was premature. And so you'd also want to know, was there any speech issues? Have there been any physical impairments? Anything like that. So the medical and physical health history is the basic information you get first. Then you also want to know about the family, right? So the family structure, the dynamic at home. The family is that core of that child and what their surroundings are like. And so if they are intact and have lots of family support and, financially, that's not a stress, and they have, shelter, good nutritious food to eat, that's wonderful. That's what we hope. But that's not the case for every child. And so knowing what the family situation is really important. So that includes if parents are together or if they're divorced. If they're divorced, you need to know legally who's got guardianship. You need to know who is allowed to be in that child's life by law, how much time, what days. And so you've got to make sure you have that figured out. The socioeconomic status of the family. So that's, again, how much money are they making? You don't need to know the specifics. It's more about what are they able to provide for their child? And does that include those basic necessities of life? And any other stressors in the family. Have they experienced a recent loss, whether it be a pet, whether it be a family member? Many families are under stress right now. And so it's important to know what stressors are affecting that family and how we're seeing that and how the parents have seen that affect the child. And then do they have siblings? Are they an only child? The dynamic at home is very different with siblings versus an only child situation. And so getting used to a new environment may or may not be harder for an only child because they're used to low stimulus. And then when they go to preschool, there's a lot of other kids. And so sometimes that can be overwhelming. Sometimes it can be just what they need because they've been dying for somebody to play with. But again, that kind of information you're going to get from the family. And that helps you know that child a little bit more than if you didn't have that from the beginning. You also want to know about the child's habits and routines. So eating preferences. What kind of foods do they get at home on a regular basis? Are they getting a wide variety of food groups and nutritious foods? Do they not have enough food at home? Is it scarce? Do they only consume unhealthy food, like fast foods and really highly processed foods, such as chips and candy and things like that? So finding out what is in their typical diet, and you don't have to, there's nice, gentle ways of asking that, like, tell me what this child might eat on average in a day, and have the parents write out some of the foods, right? Whatever comes first to their mind is probably what they're eating more often. And so that'll just give you a little insight. It's important to also know about their oral health. Sometimes we don't think to ask some of those questions, but oral health has a big impact on young children, especially if the nutrition is poor. Then they're more likely to have oral health problems, more cavities, potential infections, which leads to pain in their mouth, which leads to, more pickiness with what they eat, which just creates a cycle of poor nutrition. It might mean that their speech is muffled, or they might be holding their mouth differently because of a pain in their mouth due to their oral health conditions. And so then it affects the way that they're learning to speak and form words, especially if this is a chronic problem that's over time happening and not taken care of. And so it's important to find out, when did they last go to the dentist, or what are their teeth brushing habits, in conjunction with what kind of foods do they eat, because that'll help put that puzzle together to give you the full picture of what their oral health might be. What are their sleep patterns? How well do they sleep? Are they sleeping through the night? Are they waking up multiple times a night? What time do they go to bed? What time do they get up? All these things are really important. And also, of course, if they're potty trained or not. And then, sometimes that is a factor for whether that child can even join the preschool or join a care center. If it's something that this care center is willing to work on, then how are you working on that at home, and how can you continue that at the care center? Those are important questions to find out so that that child has consistency with that. And then behavioral health. And this kind of goes hand in hand with communication. So what does the family see as the type of social skills that this child has, not only with other children that they've interacted with, but with other adults? Some children will be very shy around adults, but very outgoing with young children their age. And so it's important to find out what their social skills are like. Also their affect. Now this can be a little bit tricky if the child maybe has some traits that the family isn't happy about. It can be hard for a parent to really fully disclose some of that, like, why, yes, my child is very aggressive with other young children and sometimes a bit too rambunctious, right? That's not something that you usually as a first time meeting want to really indulge. But nonetheless, it's important to try to get as much information as you can about the child's typical affect. You want to know what they are sort of at baseline to try to either help them in that area or to know when something's off or when they're not feeling right. And then you also just want to think about socially, behaviorally, in terms of their affect, you know, is this related to potentially the family dynamic? Is this related to a medical condition? Sometimes, almost all the time, children's behavior there's a reason for it. It's not just that they are innately bad, right? Or innately good. It's because they're given the right path by the adults in their life to either go down a path where, you know, they have more self-regulation and they have more self-control and they make better choices, but that's because they're eating nutritiously and their blood sugar stays more stabilized throughout the day. It's because they aren't in pain from some kind of chronic condition or oral health issue that hasn't gone untreated. It's because they have food when they need it and they have a safe home to live in and they don't have traumas going on in their life. So there's a reason. Anytime a child has what we perceive to be more negative behaviors, there's a reason for that too. And it could be because the family dynamic at home is very, very strained and stressed right now. It could be that, you know, they have a chronic condition that hasn't been addressed yet or figured out. And it could be that they're only getting junk food to eat and their body just doesn't know how to handle that. Their little brains need healthy food, not just sugar and junk. And so there is a reason for all of this. So getting a health history like that really helps you learn more about the child, right? It helps you understand this child better even before they walk through your doors. And so there are things that you can consider for that child. You can modify the learning environment if that's something that's needed, accommodating any kind of special needs, especially if they're physical needs, right? You can set up the classroom in a way that works for all the other children, but will certainly help this child out a little bit more. Over time, obviously not maybe in the first meeting when that child first starts, but over time you can eventually help that family come to realize that maybe there's a need for some professional evaluation because you've had observations that help the parent also see that there's a concern. And then once they get that evaluation, how to funnel them to the proper referrals. And so we'll talk a little bit about that. So one of the first things that most often gets checked even when there's a behavioral situation needs to be kind of just your typical sort of well child check. If you have children of your own and you've taken them to a pediatrician, this includes a lot of developmental questions as well as physical growth and health. These are really important because it supports the preventative care philosophy. So kind of like when I talked before about my daughter and her eye issue, we didn't go to the doctor because we thought she had an eye issue. It was something that was discovered in this preventive care well child check. And so that's really key, is even when there's not a problem, to regularly have children have those checkups, because sometimes it leads to early detection, right? So early detection of any kind of impairment, and especially if we're thinking about the senses, the 5 senses, children rely so heavily, especially on sight and hearing in those first few years of life to gain those cognitive skills that they need, that's going to set them in place for future learning. So their language development is key during this time. And so if either of those are a problem, it leads to poorer outcomes and potential developmental delays or cognitive delays, more struggles with academics. And so we want to get them set on the right foot. It also helps to identify a need for professional evaluation. So some of these basic screening procedures, like when my daughter had that eye exam, we didn't leave there with a diagnosis. We left there with, well, she's not seeing out of one eye very well, and that's all we knew. And so that led to the referral to the ophthalmologist, who's a more specialized doctor in eye care, and that led to a diagnosis eventually with a prescribed treatment. But again, these screening procedures and early evaluations, those are really just to see, is there a problem? Because if she could see clearly out of both eyes, then great, right? If you have a child that's very distracted in your class and has trouble focusing, an eye exam is a great first step, because if they can't see clearly what's happening, it's not going to keep their attention, right? The next step might be, okay, if eyes are fine, let's take a look at their ears. How's their hearing? Because if they can't hear what's going on, then they're just kind of in their heads in their own little world, and they're not going to focus either, right? So those are some really basic early screening procedures that need to happen. And again, this is all used in combination with observation. So the teachers, the care professionals that are with these children day in and day out, along with the parents, are putting their observations together to really help add that layer of emphasis on the need for a screening procedure. And that combined with a medical history, let's say there is prematurity for this child in their history. Well, having eye or ear issues can be very common for premature young children. So it just makes sense. And it's not that something's wrong with the child, it's just they need a special set of care to get back on track. We talked last chapter about daily health checks. And again, your observation skills and your assessments during those daily health checks are going to be really critical for some of this, because you're going to get a little backstory from the parents about the night before and how they slept and all those things. And you're going to be able to piece those observations together more succinctly. So we see doctors using other types of screening procedures, typically height and weight, to make sure they stay on that growth curve. That's important. Their body should be developing at a certain rate and be within certain parameters for that to be, a healthy range. The eye tests, the hearing tests, those are all part of normal developmental screenings that should happen regularly for young children. Again, this helps with their speech, and if there is any kind of concern, getting speech therapy involved early is really beneficial and can be a great asset. Your book has a chart about speech and language development. Somewhere around page 68, I think that might be referencing the old textbook, edition number 9. But if you have edition 10, then it might be off by a couple pages, but somewhere there's going to be a speech and language development chart, and that can be really helpful to reference. And then also, part of all of this is their nutrition. We're going to spend a lot of time on nutrition. Chapters 12 through 18 essentially are, 12 through 14 are hardcore nutrition, but 12 through 18 are nutrition and feeding practices for young children. And because it's so critical. It's so critical to their health. We're going to take a quick break with the slides here, and we're going to look at an infant screening, vision screening. So let's take a look at that really quickly.
In this activity, you can see how babies develop the ability to follow things with their eyes. All you need is a comfortable infant seat and a colorful toy that you can gently shake and move from side to side. Before we consider how babies move their eyes, let's discuss two different ways that adults move theirs. We make saccadic eye movements as we scan the environment around us. The eyes make abrupt jumps, called saccades, that last a few milliseconds apiece. In between the jumps, our eyes remain relatively still. We make smooth tracking movements when we follow a target with our eyes. Notice that the eyes move smoothly from place to place without making abrupt jumps. We can only do this when there is a directly visible target moving in front of us. Infants are born with the ability to make the jumpy saccadic eye movements. Smooth tracking, however, only seems to show up around 7 weeks of age. By watching your child carefully, you can see this ability emerge. It's important to note that young babies are usually only awake, calm, and alert for a few hours per day. For all of the activities presented in this video, we have selected clips in which the infant actually performed the task, except for this one. Don't get frustrated if your child doesn't accomplish some of these tasks the first time you try. It may be that your baby is just drowsy or hungry. The best strategy is to wait and try again later. At 1 week of age, this little girl is able to follow a toy as it moves to her left, center, and right. As she does so, you can see her saccadic eye movements. In this clip, taken a few days later, the saccadic jumps are very clear, especially when we slow down the video. Notice how she looks at the toy but doesn't immediately follow it when it moves to her left. When she does, her eyes make discrete jumps. Here, here, and again here. A week later, we can still see the saccadic eye movements, but the jumps are smaller and faster. Research has shown that the movements are also more accurate and more able to anticipate the motion of an object rather than just reacting to it. As your baby's neck muscles get stronger, you will notice that the object can be followed across a greater range of motion. As the arms get stronger, you may notice the beginnings of reaching movements. More on that in Activity 4. Your baby will also get better at seeing the object from further away, even as far away as the feet. A close-up of this 5-week-old shows the eye movements well. They are rapid and accurate, but still no smooth tracking. The brain systems responsible for this are not yet fully functional. Around 2 months of age, we get our first glimpses of smooth tracking. It's easiest to see if you use a small toy and stop shaking it once you have the child's attention. Notice how the eyes move to follow without lagging behind the target. Notice also that the abrupt jumps in eye position are almost completely absent. Even at this age, however, most eye movements are still saccadic in nature.
Okay, so we're going to go ahead and stop it there. It's pretty fun to see how that baby progresses too, and how she changes just in a few short weeks. I know I felt that way about my own kids, but you don't usually see them so close together at different ages. So you can kind of see there how the vision, not that you would be doing a vision test like this in a school or at a daycare, but being able to see what medical professionals are looking for can be important. And so seeing some of those first early ways that they do different types of screening and why they're doing them are important. Okay, so next we're going to look at kind of the evaluation and referral process. I've got a video here again to show you of some things to consider or what an intervention kind of looks like when multiple specialties need to be involved for an evaluation. So this might be something like when children receive IEPs, so individual education plans. And so we're actually going to go back, just stayed over here, to in the way. Here we go. Okay, so this referral process, we're going to, or to how to prepare your child for an assessment, and what a typical assessment will look like. So that's really what we're going to look at. We're going to look at this part called what would a typical assessment look like? And she just explains through some of the different professionals, but even more than what she's saying is watching how they interact with the child and how they use play in a way that helps them learn how children are, cognitively where they're at, their speech and language development, which includes hearing, and their ability to understand what you're asking and then be able to demonstrate that on a picture and point to the right object. They're using all these different techniques. And so this video shows that pretty well.
When a district is about to test a child, a preschooler, for special ed programs, they might use multiple different types of assessment. One of them might be a transdisciplinary play-based assessment in which the child actually gets to play, and sometimes they'll be playing with a play facilitator, someone on the floor playing with them, and part of the time they will involve the parent and play with the parent on the floor as well. During this assessment, the parent is typically involved through playing with the child and also answering questions and being allowed to ask as many questions as they want about the play that's going on and what kind of information they are gathering from the child. So I encourage parents to definitely ask if they're not being told what is happening with the child. If they have any questions, this is a good time to ask about what kinds of information they're gathering from the child, why they're doing what they're doing during the play session, etc. Then the other type of assessment that they might use, or they might use a combination of them, is they would probably do a traditional standardized assessment as well. And that would look like a child sitting at a table one-on-one with an assessment person. All right, look. This is a P. Can you show me a P? There's a P. Where's the other P? Turn the page. So that's just a one-on-one testing and with a preschooler in a book, and asked to point to or name lots of things in a book and assessing their cognitive abilities usually, but other abilities as well. Now point to the thing that I say. Point to the tiger. Very good. During a play-based assessment session, there will be lots of people in the room. The parent, of course, somebody playing with the child, the play facilitator, and then there will be multiple other assessment staff sitting around, either around the room or around a table, jotting down information that they are gathering from the child. Sometimes they'll have a protocol on which they will put the information and checking off things that the child can do, writing notes about what the child can do. Sometimes they will just write down the information and then later compare it to a developmental sequence to see where the child is functioning in multiple areas. So this group usually includes a speech therapist, might also include an occupational therapist, a physical therapist, sometimes a nurse, and some other assessment personnel, whatever is needed for that child. If a child has an auditory impairment or a visual impairment, a teacher for the children with auditory impairments or visual impairments would also be included in that team.
Okay, so that just gives you a little peek into what that might look like for a young child. So the goal is not to sit them down and talk to them and have them recite information and be intimidating. It really is typically play-based, or it should be play-based, so that children feel as comfortable as they can. So it feels like a natural, familiar, normal environment for them, because that's when you're going to get the most true response from the child. If they're feeling like they're being quizzed or tested, or it's a right or wrong, pass fail kind of situation, a very sterile environment, that's when you're going to get an inaccurate response from that child. So most likely they're not going to be able to share as well as they could or think as well as they could. And so then they're going to perform more poorly, which obviously then lends itself to a different type of outcome for that child. Some things that are good to think about really is, how a situation like this can help make connections with families. And that's really important. Having the parents involved, so having that parent there is really important for that child, because parents are typically the safe person for that child. And so if they're in a room that's, even if it's a play type space that's unfamiliar, and then there's more people and they don't know who those people are, that can be overwhelming for some children or intimidating, especially for younger age groups when, separation anxiety or stranger danger is really high. So it's important to keep parents involved and have the parents have that good relationship with the evaluators, so that the child picks up on the fact that mom and dad are comfortable with these people. That means I can be comfortable with these people. They feel really calm and seem at ease, like that parent did in the video. That makes the child feel more comfortable and at ease in that environment as well. And then the point of having this multidisciplinary team is really to figure out what resources this child needs. It's not to create labels. It's not to put them on a certain path that's set for life. It's really to say, what do we need to give you to help support you so that you stay on the right track? And so having all these different disciplines, different perspectives, different ways of looking at the child from different ways is really important, because we cannot be specialists in everything. Even a parent has a parent filter over how they see their children. And so sometimes it's hard to recognize your child has a problem when you're a parent, or maybe you don't even notice that it is a problem because you don't have other children to compare it to. And so you're thinking, well, this just seems normal for my child. And in fact, it's not. They have a need for resources. And so having the perspective of a physical therapist, having the perspective of a nurse, a speech therapist, an occupational therapist, all with a different lens that they're looking at that child through is really, really key. Again, we want to establish really trusting partnerships with the parents. This starts with the daycare workers, the preschool teachers, the elementary school teachers. If you don't have a good relationship with the parents, then trying to help them seek out help is going to be that much harder. Because if they don't feel like you're part of their team, then it really becomes a struggle to get them to accept what you say as something that they need to do for their child. So it's really important that we establish those relationships very, very early on, and make sure that we're recommending people that they see. If we're recommending evaluations or pediatricians or other supportive resources that we are recommending people that work with families really well. And then this is also an important point for the people that see these families regularly. So that's usually the teachers, the preschool, and daycare providers, is that follow-up. Sometimes, because it's always the responsibility of the family to seek these evaluations and resources for their child. You can suggest it, you can give them names and numbers, but it's their responsibility to do it. And so one way to help keep kind of nudging them along if they need that support is just following up. Hey, what time did you say, or what day and time did you say that dentist appointment was going to be for little Mikey? Oh, you haven't made one yet? Oh, remember, his mouth is still hurting, right? There's ways that we can help to kind of encourage, to follow up, to see if they have made those appointments that we have been suggesting that they make, without being a nag or without, really, like wagging your finger at them, like, I told you needed to do that. But gently finding out and reminding them of the things that you're observing, right? It's not that your opinion is, it's, I've noticed this in little Mikey, and it seems so hard for him to eat snack each day. Sometimes he's in a lot of pain. He really needs to see that dentist. Did you lose the number? Do you need the number again? What can I do to help you make that appointment and follow through with it to get him the help he needs, right? So making sure that you don't just take their word for it that they're going to do it and never ask about it again, right? It's important that you follow up. And then, of course, once you get results from the parents back from these evaluations and these referrals, that we make modifications if we need to, that we help create an environment that really provides that best learning outcome for young children. That's the whole point of these referral processes and evaluations and screenings, and knowing about the child with their health history before they even walk through your door, is so that we can create an environment where they're going to thrive and grow as best as possible. All right, that is the nuts and bolts of Chapter 3. If you have any questions about it, please don't hesitate to ask. You have, I believe, also a health screening quiz to take. It's kind of like, don't feel stressed about this quiz. It's not a hardcore quiz. It's more just some scenarios and which health type screening would you choose to refer that family to if you were noticing certain behaviors or characteristics. So just a little quiz just to kind of see where you're at with that, because that's one of the main points of this chapter. And then also your discussion for this week. Again, if you have any questions, please don't hesitate to email me. If you want to talk about something more at length, we can schedule a Zoom time. I'm happy to connect with you all.